एस्मा हम बहुत सालों से जानते हैं, बहुत पीढ़ियों से जानते हैं। ये ऐसी कंडीशन है जिसमें हमारे एयरवेज जो है, छाती के एयरवेज, इसमें इन्फ्लेमेशन होता है। दीज एयरवेज गोइंग टू स्पैज़म, देयर इज कॉफ, काफ़ी बलगम पैदा होता है और लोगों को सांस लेने में तकलीफ होती है। ये बहुत कॉमन कंडीशन है। इट अफेक्ट्स रफली अबाउट 250 to 300 मिलियन पीपल वर्ल्ड वाइड। और इंडिया के एस्टिमेट्स ऐसे है कि करीब 2.5 से 3 करोड़ लोगों को इंडिया में एस्मा की बीमारी है।
Symptoms of asthma, right? So yes, so cough, breathlessness, wheezing. Of course, they are the three commonest symptoms that a patient can have, and very often these symptoms are nocturnal, more at night or early morning. The other important thing to note is that these are paroxysmal or episodic. So the patient can have symptoms for 3 days if with a seasonal change, and then they are absolutely okay for 3 months. And again they can have symptoms when again there is a trigger. So these episodic symptoms where in between episodes you're absolutely fine is very classical of asthma. The other thing to note is that these triggers or these variations in symptoms are very individual to the patients. Some people's triggers are certain food items or a particular plant that grows in their backyard. So every time there is pollen season, the patient will have symptoms. Sometimes it's just seasonal. Some people will have symptoms in rainy season or winters, or so it is so individualized, and that is very classical of asthma symptoms actually.
Right. Asthma attack in many cases, not in all, but in many cases is always a 60-40 split. Okay, so 40 to 50% is an asthma attack per se, and the rest 50% is a lot of panic. And it's fair because if you can't breathe, you're going to panic, right? Yeah. But panic creates you to become or makes you more breathless, and that is another unfortunate fact also. So if that is the case, and that happens most of the time with us, that's when we have to tell reassure our patient that to relax, calm themselves down, okay, and not to get very frantic. There is always a 4-4-4 rule. It's a 4-4-4 rule. We always tell our patients, if you get an asthma attack anytime during the day, number one is take your inhaler, one puff, and take 4 deep breaths inside, and then wait for 4 minutes. So that is 1-4-4-4. Do this 3 or 4 times. If that does not help you, that's the point where you have to end up going to a hospital. This myth is actually there because many patients think or actually know that there are steroids in inhalers. So they think if I take this for a longer duration of time, it is going to do something bad for me. But to be very precise, the steroids in inhalers are in the most minimalistic format. If you take a tablet of steroid, it is in milligrams, right? 5 milligram, 10 milligram, 20 milligram. But if you take inhalers, please check the box. Their steroids are in micrograms. Number one. Number two, these steroids do not enter your blood system at all. They enter the lung and they only work in the lung. They don't come into your body. So it does not really cause that long-term damage as most people think they are.
Here's a very common question. बहुत लोग पूछते हैं ये सवाल. Asthma cannot be cured, but उसको completely manage कर सकते हैं. And there are some people who outgrow their disease. So कुछ साल तक उनको inhaler लगते हैं, for example बचपन में. And फिर जैसे जैसे उम्र बढ़ती है, environment change होता है, body, hormonal changes आते हैं. Some people outgrow it. So it cannot be cured, but it can be completely managed.
Till today, unfortunately, inhalers have become still the stigma कि ये मुझे use नहीं करना है. Even today, I get patients who come to the hospital and are breathless, and we give them an inhaler and they're like, एक दिन use करना है ना, या 4 दिन के बाद छोड़ दूँ चलेगा, या इसको लेना ज़रूरी है, कोई गोली तो नहीं है. No, they have these questions which are completely irrelevant, but because of the stigma of that one small device that we have. It is the mindset that has to change and not the device per se. The devices are there everywhere. If your mindset changes towards that device, that it is nothing big matters. Like for example, I always tell my patients that one of the biggest problems they have is, one, it is embarrassing. And number two is they feel that it is going to be addictive. To be very clear with all the patients, they are not addictive. We as a society have made this belief that wearing or using an inhaler is a bad thing.
So there are many such platforms where patient connect, patient support, and patient education is in the forefront. And where we are seeing this Breathefree is one of these applications where you can get a lot of answers to your disease and a better understanding of how to manage your asthma.
I think if you want to live a completely normal, happy life as an asthmatic, please don't be scared of inhalers. Use them as required. If you have a problem with accessing them, I would suggest find a specialist who can give you the right treatment, the right location of where to use it and how to use it. If you know the right way of doing things, you will have a great life ahead, as exactly same as any human being in the world.